You just start recording, everyone. Give me a second.
Just tell
The
them
most important thing is, so let's do this. You're gonna mute, we're gonna mute all without the ability to unmute. People that will be able to unmute is Madeline, me, and the office. She had class at 5:00, and so she didn't want to risk coming late or anything like that.
Hi, Madeline.
Meet for the next meeting. So,
Hi, how are you guys?
yeah, if that's too loud, we can turn on the volume. It's good to as a co-host as well. So they can unmute themselves. Everybody else, they have to raise their hand.
Now, how do we get this young lady on after Janelle? She just comes.
Was she registered to speak?
Yes.
Do you have me put her on the agenda?
Yes.
She should be there.
She is.
Okay. So after the presentation, just follow the agenda.
And then she just comes on and talks and they'll pick it up. She'll go on. Because she's here in person, will people be able to see her?
Yeah, well, I can see the back of her head right now.
So she can just sit over
She
here.
wants to
That
throw-
I told you could come
You
and
can
see
change
her.
the camera, but just wait till you're ready for that. Wait till you get to the gallery, right?
Okay, but she's
So-
not in the gallery because she's
She's a presenter.
a presenter, Janelle.
Well, you told,
I said to put her on.
I was the impression that
Oh, that's right.
you said that in 2 minutes anyway.
Oh, whatever, but okay, no problem.
All right, so,
Okay.
look, push comes to shove, you need me to come over, look, I'll run over here.
Thank you. And then
Thank you.
is Cynthia coming for the bylaws?
She's online. I think she's gonna try to be online tonight. So, until, just let me know when the meeting's over,
Okay,
all right?
all right, so we're gonna begin right now.
It is recording, so yes, if you do introductions, date,
Right.
time,
Good evening, everyone. Today is February 24th, 2025. This is the meeting of the Health and Social Services Committee. We had to reschedule due to the threat of the storms on our normal time. I'd like people to introduce themselves. I'm Sandra Unger, Chair of the Health and Social Services.
I'm David Levitt.
I'm Pat Cambria.
I'm Dr. Tutu Musadiano.
Right, these are all board members. I don't have the minutes of the meeting, so we will take them up another time. And our guest speaker is Madeline. So Madeline, it's all yours.
Hi. I'm sorry that I couldn't be there. But I do hope to. So I'll get into that. Let me share my screen. Okay. Okay, can everyone see my screen?
Well, yes, now we can.
Okay. How does that look?
The picture looks good.
Okay, great. So today I'm presenting at the February Health Committee, and I'm going to be discussing the project proposal that I was provided, also some information about me. Oh, and then we're starting with an activity, and so my project will cover a survey of seniors, use of technology and social support, and then it'll also be the creation of a resource or some sort of activity or facilitation targeted at the needs of community members. So based off of the findings of the survey.
Madeline,
About me. Pardon?
I just had a question. I was wondering if
Mm-hmm.
you could upload the information from that you want to put on at our website from the community board. Will it be-
Yeah. Yeah, I think that would definitely be a goal. But so I'm really trying to let the survey inform what I do rather than do what I want.
Okay.
Okay,
Okay, so about me, I am getting my master's in social work from Fordham University. I also am completing an internship or fellowship with the FCNY, the Fund for City of New York, and they have placed me with Bronx Community Board 11, which is very exciting. I also work for New York Connects, which is a Department of Aging program. And actually the nonprofit I work for is the same as the presenter we'll be having after me, which is fun, PSS. Okay, so now I have an activity. Let's see if this works. It's okay if it doesn't, but does everyone have a phone?
Yeah.
Okay.
what you guys do.
So I'm also gonna send this link in the chat
Okay.
for those online that might be on their phone. Okay, so I sent it in the chat.
So I think she wants us to take a picture of that, right?
Yeah, you can
You have to
open
check-
up your
You
the
have to
camera
leave
on your phone.
The X, get it on the X.
Okay, wait, where is it? Okay.
On the right.
Oh, here it is.
Yeah.
Here's the cursor.
So let's see.
Yeah.
Oh, we did it.
And then so the question is, where are we attending from, either virtual or in person? Let's see.
You should get 2 or 3 in
Virtual
person.
person. Okay, so-
And so we can
In person.
can everyone still see my screen?
Yes. Yeah,
Yeah.
we're in person, submit.
Oh wait, maybe I am not on my own computer right now. Maybe I would have to log in.
Right, because it says the
Okay.
presenter hasn't changed slides yet.
Yes.
Oh, yeah, I think I have to log in. Okay, let's see. Sorry. I should have done this. Oh, wait. I think, how about, do you think it'd be interesting to see what the results are right now? I'm gonna stop my sharing. Am I still sharing my screen?
Yes.
No,
Okay, great.
No, you're not.
I'm not sharing your screen.
Okay, what about now?
Yes.
Okay.
Did you do it?
No, I didn't get it.
You should have at least 2 people who did it in person.
Okay, great.
Did you do it, Janelle? Okay, so it'll be 3.
Let's see if this works. Yeah, my personal laptop just broke. So unfortunately, I don't think this is gonna work right now. I can share the results later.
Let me get out.
But yeah. But so we would see it like live. I'm sorry. We would see it live. The results come in. But the takeaway of what I wanted from this was that many people are attending in person and virtually. So yeah, that was the takeaway. So this is the proposal provided by the board to create a community resource guide database. How can we compile and maintain a comprehensive community resource database to improve access for Bronx Community Board 11 residents? Create a digital guide of local services, organizations relevant to residents. Community Board 11 residents require better access to healthcare, education, and social services. Centralized information will enhance engagement, improve access, empower residents. So deliverables could be online database, regular updates, increased usage, positive community feedback, sustainable ideas are deliverables of success. So then this moves on to the project that I'm doing. So I don't have like web development background, but I think I'll be able to create some sort of resource that is engaging online. So my background thinking is that Bronx Community Board 11 is witnessing a substantial increase in the population of older adults. According to the American Community Survey, residents age 65 and older grew significantly. And so it's very important to our community to understand and address the needs of older adults, especially in the areas of healthcare, social engagement, and transportation. So this is from the survey that I did of, so I got 10 responses of board members and staff. And so there are many different, the top issue is clearly affordable housing. Second would be public safety. And then, seniors is then one of the top issues. And this is a chart I made using the American Community Survey, which is like the yearly census, showing that. So in these areas, can you see my cursor?
Yes.
Yeah.
Yeah. So in this area, here,
I
like
think
this
it's
shows that there's.
Let's move it right there.
Oh, okay.
It's on the, it's right there. You're
It's on
right.
the
You're
yellow
looking at
line.
the one outside, the one inside the.
Yeah. So right here is showing that,
Yeah.
other than like people age 30 to 34, this is the only area of growth in the population. And then this was from the community health profile, I think made by Department of Health, and that Morris Park and Bronxdale has elevated risk of fall-related hospitalization compared to the rest of the city.
Wow, that's
So this is the survey I've made, right? So later this week, I'm going to Rain, and I'm also going to the other PSS Senior Center, Parkside. So these are the questions that I've made. So they really hope to understand how seniors or people that go to these senior centers, if I'm not able to diversify the population enough, how are people using the internet and technology, and then who or how do they get assistance when there's a task they're not able to do. And also, there's also like very limited biographical information, like primary language, age, relationship to the community board at district. But it's really mostly not collecting a lot of personal information. And I also translated it into Spanish because Parkside, the director, said that I would definitely need to have it in Spanish. And so these questions I think are available online in the agenda. But I would also, I'd be happy to send it over if someone sends a message or email to me. And that's it. Let me go back. Or does anyone have any questions?
No, nothing.
Okay, great.
Thank you.
You're welcome.
So I'm taking notes. So if somebody wants to refer to your survey, what can I say as far as, will there be a link at the, will you said you were gonna put a link so they can refer to it with their link from this meeting?
Yeah, let me check the agenda.
Okay,
If it's not posted in the agenda, then after this meeting we can try to work together, or I can try to figure that out.
Or we can have Jeremy put it on the internet.
Yeah.
Which would be
Yeah.
easy. So I have your presentation, you sent it to me. I think I sent it to him.
Oh,
we
so
can-
I think my presentation is on the website, is on the, like the document that you click in. So I'll link the other documents in my presentation.
okay,
Okay, great.
So all they have to do is look at the meeting
yeah.
and see. Great.
Okay.
Do you want to add anything?
Well, I guess I'm wondering if does anyone have any opinions or recommendations? Um yeah.
Well, I
Or
made a recommendation to you because I said there is a large Albanian population in this area and also a large Muslim or Arabic, and to try to get the surveys
In those
in those
languages.
two languages.
yeah. So I will definitely try to do that. I think the first step for me is to find somewhere that can have me come. And to see if they want me to use those languages. But I think I also, yeah, so over March, I'll try to get more diverse,
Isn't there
like
a mosque
populations.
on Mace Avenue, or is it Waring? The big new mosque off the corner, and you may be able to get some information from them.
Yeah.
'Cause
maybe.
that's, yeah.
Okay. Yeah, I'll
Yeah.
definitely do that.
I don't know if Bengali and Arabic is the same.
I don't know.
Bengali?
No.
I'm
that-
from Bangladesh, they don't speak Arabic.
No,
but
but there are some there's a lot from Yemen. There's also the area here that's called Little Yemen.
Yeah, Little Yemen.
And I know Yahel, who used to be the chair here, he could probably, or would help in getting it translated.
Yeah.
Yeah.
Yeah,
Great.
but you can see it even here on some of the information, there's a whole bunch.
Yeah.
Yeah, okay. So should we have
Thank
Janelle come in now then, if you're finished?
Sure.
And
Yeah,
then
I'm all done.
Thank you.
Yeah,
That's good.
right. Our next person who's going to speak is Janelle Pemberton, and she knows Madeline, so. No, I think it's just adding to what she said, right?
Yes, thank you. So I'm a social worker at Presbyterian Senior Services. And our case management program opened last July. So basically what happened, many people were familiar with JASA. It's another agency for seniors, and RAIN, as Madeline had mentioned. And JASA had districts 9 and 10, and RAIN served District 11.
Okay.
What does JASA stand for?
Yeah.
Jewish Association Services for the Aging.
Okay.
Yes, so they're still open with the senior center, it's a big agency, but the case management programs, the contract ended last July. And so Presbyterian Senior Services came in and basically acquired districts 9 and 10 from JASA and District 11 from RAIN, because RAIN was doing the case management for District 11. So now we have it. And then one of the benefits of us coming from JASA is that we were able to bring all of our clients over
Okay.
and the staff to keep things going. But because we only had 9 and 10 and not 11, we weren't really engaging in District 11. So that's why I really wanted to come today. And when I saw that it was a committee on social services, it just made sense. And I also live in District 11 myself. So we're really trying to get the word out. Like Madeline was saying in her presentation, there are services that are available, but it doesn't matter if people don't know about them.
Right.
So we're really trying to get the word out, being more out in the community, more outreach, getting to know the different people, setting up some events and going door to door with our flyers, trying to meet people. We do a lot of services. We have the Meals on Wheels program, which people know from RAIN.
Yeah.
So RAIN is still the one that does the meal services. We have an ISEP program, and ISEP is basically it's EISEP. It stands for Expanded In-Home Services for the Elderly Program. Yes, ISEP. And that's just a form of home care services that are authorized by the city, by New York City Aging. And it's a good program because it's done on a cost share basis. So we have some people who don't pay anything, but a contribution. And it's for light housekeeping, personal care. It's not
That's
any type
good.
of like medical home care.
Right. That's good.
Yeah, because sometimes, a senior
Yeah.
might just need someone to come in once a week to do the
Just
laundry,
Yeah.
but they can live at home. So the
Right.
goal is to keep people at home and
Yes.
not having to transfer
Right.
people to
Oh,
work in
yes.
homes that they can be in their house.
Right.
And we find that a lot of seniors, they just need that one person to come in to shop or like to do the grocery shopping or the laundry or whatever, and everything else they can do for themselves. So it's really a good program. There's also a friendly visiting program. And that became really big during COVID because the seniors were very isolated. Obviously, when COVID came, everything went to the phone.
Yeah.
And most people still do on the phone, but a lot of our seniors and volunteers meet at their house. They'll go to the, get a coffee. And it's not just people matched up sporadically, it's people that have things in common with each other. So the relationships are, we have some who've had the same person for like 7, 8 years. And then in addition to that, there are also mental health services that either the senior can come in person for it, or they can have the social worker or the therapist go into the home. Some, it can be basic, just, counseling, to more advanced, psych therapy if people have certain, things that they're dealing with. We do grief counseling. We also have services, you contract with Essen Med. And Essen has a great program that many seniors are not aware of, where they will provide doctor visits to come to the home, and there's no cost for it.
That's nice.
You don't have to leave your doctor.
I have a question. Must they be on Medicaid and Medicare?
Any insurance.
Any insurance.
Any insurance.
Any insurance?
Any insurance.
Wow, that's good.
They don't have to drop their own TCP. This can just be someone that comes in once a week to like check blood pressure or check sugar or get their nails cut or something.
So that's a medical, what is it?
That's Essen Medical.
ESSEN.
Yes, yes, you might have seen
Listen.
because they have urgent cares, but they
Yeah.
also have a specific unit that we work with where we get the doctor to come, because some people it's difficult for them to get out the house to go to the doctor. And so our goal is really to crush whatever barrier is there to get the service in.
Is there a number where they could reach you, and let's
Yes,
get it out there?
yes, yes,
Before we,
yes.
even before you continue, just so we don't forget.
Yeah,
Yes, I have to look through my phone for the number
okay.
and the email to give, yes.
Okay.
But yeah, they're a pretty good program. And they also they have also a unit that specializes in older adults who have dementia, with Alzheimer's, because we found that was a big barrier to medical care, because you don't have doctors who are familiar with working with people with these issues.
Yeah.
Are these the numbers?
Let me see here. Oh, that's my number.
That's
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 me.
my personal number.
But I'll send you the essence stuff specifically.
Okay,
Yeah,
okay.
that's mine.
Spell out the Essen.
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 E.
ESSEN. I think there's an,
I've seen it.
Yeah, they
The
have.
one on, Eastchester Road in Astor.
Yes, yes.
There
those
was
are
something else,
users,
yeah.
Exactly.
Is that
They
the
have
Montefort?
no, they're separate, a separate.
Private.
Yeah.
E-
They do regular urgent care for everyone, but they have that specific
Okay.
private home care. And the thing with the doctor visits, people think, oh, I have to have this and this. It's 18 and up. And this is free. It's free. It's free medical care. You don't have to leave your doctor, because that's, people have their doctors for years and years and years. They want to keep their own
Right,
doctor.
right.
But it's good just to have, I might need someone to come in because this person like has a fever,
Yeah.
and they'll come.
Or
emergency
they have
visit.
like an eye infection. or
Exactly,
UTI.
exactly, absolutely.
Okay.
We're just trying to get rid of all the barriers that prevent people from going to the doctor, because sometimes it could be as simple as, I just can't get up today.
Yeah.
So I'll have somebody come to the house. And, case management is pretty much a big umbrella, which is just some of the stuff that we provide. And we say, if you have an issue, then if we can't solve it, we're gonna find out how to solve it. And so we just kind of manage the case, which is what case management is. That's it.
Oh, thank you so much. You've been very,
Yeah.
very informative, really,
Thank you.
and it's great. But the big thing is that they do not need the Medicaid, because many of them are on Medicare.
Yeah.
Right,
But-
exactly.
Yeah.
Sometimes combining the Medicare with the Medicaid
Yeah.
gets them
Yes.
everything.
Yes, yes, this can be one or the other or both.
That's good.
Yeah. Or even if they have, Aetna or like United,
Yeah.
other insurance, it's, and it's separate from your own.
And how do they
Don't
get,
bill.
how do they get, like, how do they join the school? How do they get?
Well, usually that's done through us, so there's, when we have people who are interested, we get a referral, we have an intake coordinator who goes and calls and, gets them set up.
Yeah.
We always verify because a lot of the times, we'll have like a daughter or a son
Right,
refer their mom for services,
Right.
and no one's told mom about services.
right,
Well,
Um,
left,
So
David.
we try to give the older adult the authority.
yeah,
Like,
should
if your
work.
daughter thinks you might need this, it's.
It keeps going even after they go.
yes, okay.
So we try to do as much engagement with the person. Because sometimes out of love, sometimes the kids try to take over.
Yeah,
Like, mom needs this, and mom
Yeah.
doesn't want that.
no,
Well, yeah, and they can call that elder abuse.
yes. How about if these, older, the seniors need to go somewhere? Is there also a service provider?
Like Accessorize.
Accessorize, like,
Yes, so we do set them up with Accessorize, they don't have. Rain also has a program for transportation.
okay,
And it's not just for medical appointments, they need to go like
if they want to go
to
to.
the hair salon or like,
Oh, that's good.
whatever.
And they're
Yes.
charged for it, like,
No, there's no charge for it. There's no
Okay.
charge for it. And then, I know our center, Madeline was mentioning, we have a center at Parkside, and then we have another one, down in Jackson Avenue.
oh,
The one on Parkside is like over by Mace, Allerton.
Yeah.
Over there. And so we're just trying to engage the community. There's sometimes other, services that we're not aware of,
Right.
that they might say, oh, well, we do this. Can you guys benefit from? And that's how we connect.
I
lot
know
of
that a
being
lot of
rich
seniors,
now.
I know that a lot of seniors, and because there's nothing here in Morris Park, but a lot of them go to St. Benedict's.
Yes.
There is a senior center, I
We
know
have
there's
a
one.
lot that go to St. Benedict's, they go to Bronx House, they
Right.
go to, the Jewish Council, I think, on Holland, because they have a
Okay.
pantry there.
Oh, I,
yeah.
Yes, but those programs they're called NORCs, like Co-op City has a NORC, Thrive Connect has a NORC. It's basically naturally occurring retirement community, NORC. So with a population of a lot of seniors, they'll put a NORC there.
oh.
But that's separate from case management.
Do you
Well,
think they
that's-
would do that here, Madeline? Do you think they would put a north, what is it?
They have a NORC at Bronx House front.
Yeah, but
Okay,
that's on the south side of Pelham
Yeah,
Parkway.
what about on
This
this
is
side?
the,
Okay.
well, wait, actually,
Yeah,
yeah,
this that side too? Are we
I always
considered?
forget.
this is the south. This is, I think Morris Park is the south. You have to go across Pelham Parkway to be on the north
Yeah,
and the south.
Yes,
yeah.
I always forget, yeah, right. So,
So I used to live on the south, now I live on the north.
yes, and that's the other thing, Pelham Parkway is huge.
All right.
And so at a certain point, we're no longer District 11, like after, I
Right.
think, Eastchester, like after White Plains going toward,
Yeah,
it's different.
it's different.
Yes, exactly. So we have like a certain, thing, but I did have a flyer here just to leave, and I think I emailed some. It's just like a broad, explanation.
Let's
So
do
the
that.
zip codes that we have here and in Spanish. And then you have my number. I'm gonna leave my program director's number also.
Now, Janelle.
Yeah.
We are going to have a health fair on May 18th
Oh,
at Bronx House.
Oh,
So
okay,
if you would like to have a table that's on the Sunday,
okay.
I'm just letting you know. Just let me know, or I'll let you know again. And you could set up your table with your information
Oh,
Yeah.
okay, thank you. And what time is that?
from about noon to 4,
Yeah.
3:30.
You said the 18th?
Correct.
Yes, May 18th, Sunday.
Because the last time we had it, it was the end of June and it was it was the heat spell. Oh my God, no one wanted to go out.
Okay.
So hopefully,
Yes,
we
great.
changed it.
Perfect, yeah.
Great.
I will send an email and then I'll put my program director. on
Yes,
so I
terrific.
can do that. That'd
All
be
right.
great.
Madeline, all right, is there anyone in the gallery who has a question? Guess not. Okay. All right, with old business,
Oh, wait, I have a comment.
Okay.
okay,
People could also call the Bronx version of where I work if they're not sure of which district they live in.
Okay.
Because
You are-
that, so it's the New York Connects, which I
Okay.
could get that number and send it in the chat.
Okay.
Yes, because it
Yeah.
gets confusing sometimes because
Yeah.
you have the community districts, but then you have the council districts, you have the senate
Right.
district.
Right.
Right.
So it's like,
It's all
yeah.
Okay, we have
Exactly.
to unmute, we have to unmute
Diana.
Diana.
Okay, wait,
Diana.
wait, hold
Yeah,
on.
thank you.
What, are you
All right,
coming on?
Diana,
Yes, now I'm unmuted. Thanks.
you're welcome. We're learning.
Yeah.
Yeah.
On the fly.
So I have a couple questions for both Maddie and Janelle. Maddie, I'm from Bronx Park East Community Association, and we would love to distribute your survey, but I don't think we could do it during a meeting because I don't think we'd get enough people there. You know, we have people of all ages come to our meetings. Maybe if we could send it out to our email list, or if we could post the link on Facebook or do both. Actually, we might even be able to post some flyers with the QR code for it. And then for the survey itself, I wanted to ask, is there a time frame? Like, when do you need all the responses by? And for the questions, do you have multiple choice answers, or do people just write in whatever they want? Like, how does that part of it work? And we do experience, you know, the fact that a lot of the seniors don't have laptops. Some of them don't even really have
Right.
smartphones, or they don't fully use their smartphones. So
That's why I invited.
there are technical challenges to getting.
That's
it
why
to
I
that.
invited Madeline to the health fair to do the survey at the health fair. They came. in.
Right. And then Bronx House
Yeah.
has a senior program, and the local library, the Allerton Library, would also be maybe a
Mhm.
good location.
Yeah, the more.
Yeah, the
Yeah.
one right across the Morris Park. Yeah. Right.
And
So
then
wait,
if
so
you're-
there's a couple.
Oh, sorry. Go ahead.
Oh wait, am I good to try to answer some of
Yes.
the questions now? Okay. So you had a question about multiple choice questions, so I can share my screen and we can look over. Would you want to? The question is, or the answer is, it's mostly multiple choice.
Okay, that's all I
Um,
wanted to know, really. You know, how do you answer?
Yeah.
Right.
Yeah,
Okay.
it's multiple choice and very little identifying information. I'm planning on having it printed and having it be virtual. So it could definitely be emailed out. PDFs could be emailed out. It could be mailed out. And so ideally I have all of the responses definitely before like the end of May.
Okay.
But ideally I would have all of them, or many of them, in the beginning of April, because that's when I'm giving a presentation for my fellowship. But it is officially going until the middle of June, right? So I think data collection will be ongoing. But ideally sooner will be better for me.
Okay. And then quick
Yeah.
question for Janelle.
Mhm.
I think I emailed you earlier.
You did. Yes. Thank you for reaching out to us. And my question for you was, how do you connect with the Department of Aging? Or-
Yes, so Department of Aging, they're pretty much the umbrella. We have
Okay.
the Department for the Aging, which is like the state, and then we have NYC Aging, which is the city. So we mostly deal with NYC Aging. And then DIFTA, which is Department for the Aging, they kind of come into play when there's like budgeting, or like the governor's office is trying to get funding and people need to go to Albany to kind of, you know, show up and support and things like that. But primarily we deal with NYC Aging, and each management agency has their specific like liaison person that we have connections with to use. We're actually having not in this district, but in Co-op City, I think Thursday, they're having at their senior center, somebody from the New York City Aging coming in to kind of just talk and present. They have a big population there of seniors. What I can also do, I forgot to say, I put together like a 3-minute kind of like PowerPoint video that pretty much like shows what we do in like a PowerPoint way with like graphics and pictures and
Can
stuff
that
like
be
that.
inserted into the link here that people can see?
Or can you send it like to Jeremy and myself, and then we put it on the website?
Okay, yeah, I don't have it here. It's on my laptop,
Okay.
but I can
All
for
right,
sure. It's
yeah.
like 3 minutes long about.
Okay.
And it just has like contact. It'll show all the areas that we cover, what we do, how it helps.
So if you
numbers.
send it to me, then I will make sure, then I'll send it to Jeremy. So-
Yes, yeah, because sometimes people, it's easier visually to kind
Oh,
of see
yeah.
things, but so.
Well, some people learn more visually
Yes,
Yeah.
than people. I
Exactly.
understand.
And sometimes, you know what, for someone that's older
Mhm.
and wants to kind of know if this is the right fit for them, and
Yes.
they see, it's kind of more approachable, you know,
Absolutely,
they're
absolutely,
not scared, you know?
absolutely, yes.
All right,
Absolutely.
so I want to remind my group and those who are present remotely or in person, that we will have the health fair. If you know of any group or any person who would like to be part of the health fair, to get in touch with me, you all have my email address. And I will, talk to them, see what they want, and then make sure they get a table.
Who's that?
Oh,
You gotta go around.
no, you could open up the,
I can open the door? Okay.
or someone could open the door. So that's it, if anyone knows of anything else. 'Cause
And
we
that's
don't-
at Brown House for us.
Yes,
Okay.
Bronx House.
You have a flyer for it?
We are, and Cynthia, I don't know if you're on. Is she, wait a minute.
I am Sandy.
Oh, okay. Remember, Cynthia, you promised to send me the flyer and to
Yes.
post it on the website. And you can put
I'll
on
do
the
that.
flyer at this point, but please send it to me for the Black Nurses Association. I'm sure Ridgewood will be coming again. I have AARP and Janelle now is gonna come. So we could add more to the flyer, but I need the initial flyer just to send out to people who may need it. All right,
Sure, not a problem. Not
Sure.
a problem.
all right, does anyone have any new business? I guess not. All right, so I am going to call this meeting to an end, and I think we stop video.
How?
I will go down.
Town, stop it?
End the meeting.
Oh, how do we end the meeting? Where does it say?
Red
Red X.
Oh, the
Red
red
X,
X.
okay.
Thank
Bye,
you.
everybody.
Bye.
Bye.
Say the time, guys.
Oh, what time is it?
It's 6:46.
6:46. Okay.
Thank you, Veronica. You might help out. Veronica.
End the meeting.
Leave meeting.
Right.
Now, leave meeting now.
We'll leave meetings.
Stop video.
No, just click the red X.
Okay, sorry. I'm so
Thank you,
sorry,
David.
guys.
All righty.
Click it again. And hit